Thank you so much, Katlego. Well, with reports of an outbreak of meningitis in the Western Cape, the disease has recently been in the spotlight. Meningitis is a bacterial infection which causes the inflammation of the protective tissue that is protecting the brain. We want to put your fears at ease this morning and bring in the experts. As you heard it, Dr. Darren Green is in our studio this morning. You're welcome to give us a call with your questions or comments on 083 9133728. Dr. Darren Green, welcome to the show.
Good morning.
All of us are talking about this. As a mom, I'm a bit concerned. I need you to put us at ease. Is it as bad as it is? Let's start first with meningitis. What exactly is it?
So inflammation of the membrane that surrounds the brain. So the brain has a cling wrap, a layer around it, which actually has small, tiny layers. And the three layers of that, they form a pad around the brain called the pia, the arachnoid, and the dura. And those layers can become inflamed and infective when an infection travels to the brain via the bloodstream or via a penetrating injury of the skull, for example, that introduces an organism directly to that. And then that membrane around the brain becomes inflamed. In bacterial meningitis, obviously, you can imagine it becomes quite swollen, red. There can even be what's called an exudate, which is like Melrose cheese that forms, like in TB meningitis, around the layer of the brain. And then, of course, you get viral meningitis, fungal meningitis as well. So a lot of people, obviously, when they hear the word meningitis, are just absolutely startled and scared. The dangerous one is the bacterial one. The viral meningitis that we speak of, that you've mentioned, is quite common. We find it often when people present with flu-like illness that then progresses to them being a lot more lethargic with severe headaches and mild neck stiffness, etc.
It becomes scary when you even know someone who's had meningitis, or in my case, someone who died of it, you know.
Indeed.
What's dangerous and what isn't? I mean, what do we look out for? Especially because they say there's an outbreak in the Western Cape. I live there.
Of course, and all parents are anxious. What is important to know about the cases that were reported in the Mossel Bay incident is that we suspect viral meningitis, not bacterial meningitis. No pathogens thus far have been isolated. In other words, like a deadly new viral strain or virus, etc. And the lumbar punctures that are done are diagnostic. We use those to help determine, is the cause of the meningitis bacterial or is it viral? And then we actually take some of that cerebrospinal fluid, which surrounds the brain and spinal cord, and grow it on a plaque to see which organism it is. And in these cases, in the Western Cape, for example, it seems that they were just viral meningitis. So they have been reported, and in some cases even over-reported, because we diagnose viral meningitis every day anyway in our province.
You can give us a call because this is your show, your Feel Good Breakfast Show. If you just joined us, 083 9133728. If you want to give us a call this morning, Dr. Darren Green, our social media or health expert in our studio, and you can give us a call with your comment or question. We're talking symptoms of meningitis. We're talking what is dangerous, what isn't. What do we look out for?
So the classic triad or three symptoms are fever, vomiting, and neck stiffness. Headaches obviously can lead you to go to the doctor in the first place. So those symptoms, if you think of fever, it can be in any respiratory tract infection. Headache can happen with any cold or flu or sinusitis. Vomiting, however, and neck stiffness, then as you get sicker, you develop those symptoms. So, you know, just a nice little visual representation. The headache, you get light sensitivity, which is photosensitivity. And then in the bacterial dangerous meningitis, you can get a rash, a purple rash, which is caused by a shortage of platelets, and you get skin bleeds, and then nausea and vomiting. So, you know, the classic triad, fever, headache, and vomiting, and then neck stiffness.
Okay, Dr. Darren Green in our studio this morning, 083 9133728. If you want to give us a call, we're talking meningitis. More after the break. In fact, Ewan, what's coming up?